Thank you. So yeah, I'm Mike Hearne. So yeah, I'm a GP, although only one day a week now at Hearne. So the rest of the week I spend talking about general practice, really representing general practice, and really kind of pleased to be here to give you really a bit of an update on what's happening in the general practice land, but also really to really understand, really help you understand really what we're doing to try and kind of meet some of the demands and the challenges that we have, but really also to think about how we can do things differently working with communities. That's really the key focus really of understanding what we can do here working with a community partnership. What we see increasingly in healthcare, and this is certainly a passion of mine, is actually there's a medicalisation really of things which are perhaps connected more with people's financial concerns or their other challenges at home, and actually there are different ways of dealing with those things, as I'm sure we'd all agree. And so some of the kind of initiatives that are going on in health are around trying to address some of those things, and how do we move towards prevention, how do we move towards working with our communities, with households in different ways. And although we're doing some of these things, I'm very conscious that health does it in a bit of a health way, obviously, and we don't always know what's best. So one of the things I'd like you to take away today is to understand how can I connect with general practice and other services, in particular with primary care networks, and actually how can we then build what's going on in local geographies around villages and around towns and market towns and things, and who to connect with. So there are some colleagues I have today, which I'll introduce as we go through, so that you can really kind of understand how do I make those connections and how do we take some of these things forward. So you heard me mention first of all, my role is yes, I work for Taurus. People often get confused, what is Taurus? So just to be clear on that, I'm here for Herefordshire General Practice. Taurus is just a thing to try and make sure we run some services on behalf of general practice. But actually the key focus here, my role really, and the number of colleagues in the room, is to try and ensure that we deliver the best patient care that we can, and as part of that, one of the things I'm trying to here just to talk you through some of those things, but particularly the opportunities around collaboration that we might consider moving forward. So some things you may not fully understand around some of the general practice setup is, one of the things is how we are funded in different ways, which I won't go on about now, but it has been challenging in terms of some of the demands of general practice. I'm sure you've noticed it possibly yourselves, if not in your communities, how kind of the increasing demand that we're seeing since before the pandemic, and now after the pandemic continues, and of course because 90% of the contacts do happen in primary care, it is increasingly challenging to deliver that right place at the right time, and we are doing our best to do that. So this is some of the things that we're talking through. But we are challenged by the funding side of things. So an interesting fact really is that I think it costs about £163 a patient per year to deliver general practice services, and that in terms of inflationary value over the last 5 years or so, 5-10 years, has stayed roughly in keeping with the inflationary increase in the cost of insuring your hamster. So really, which costs about the same amount of money, believe it or not. So it's just a daft fact, but actually the money basically hasn't gone up in particularly dramatic fashion. So we're trying to do a lot more with a lot less. There's less GPs, there's less kind of there's more demand, and of course we know that there's big backlogs at the hospital, who are obviously are challenged with regards to getting through the list that we need to do. So we're trying to work in collaboration with across the system. And of course, again, interesting fact again around the kind of number of consultations that we end up seeing. So that was the original contracts back in 2004. It says there about 4 consultations per year. Actually, it averages more like 7 to 9 per patient per year. So it just gives you just an interesting kind of idea of where we're looking at. So what we've done in Herefordshire is we've brought together, and this may not seem dynamic stuff when you think, well, isn't this obvious? But I can tell you this is not going on in other parts of the country. So we've actually brought together all of the practices working together, and we are under an umbrella now we call Herefordshire General Practice as a collaborative. So we have one voice, we are one point of contact, and that works with a number of these things called primary care networks, which I think have been mentioned. I hope you'll know a little bit more about. So primary care networks are groups of practices and other providers and communities. So I want to make sure that we're really clear about what is a primary care network. It isn't general practice and general practice alone. Yes, we've started some of the work, but the ideal function in primary care network is just around a geography that actually envelops everything that we're doing today, working with parish councils, working with our communities is really the key, going to be increasingly a key focus. So Taurus is just part of that. And this is really kind of what, this how it could look. These are the networks that take place, and some of the at-scale services. So this is where Taurus supports practices, running the GP out of hours, supporting practices with a remote hub service every day, which I'll mention a bit later. But these are the kind of things we're just doing to support the practice. But we recognise that continuity of care with your local practice is absolutely central to some of this. And I'm glad to introduce a few primary care network managers. As terms of key points contact, there's Anna, who was actually is the manager for the WBC, so it's a central one in Herefordshire, one of the central ones in Hereford. Hannah's next door to her, and Hannah does the north and west, and the names are pretty really what they say on the tin. They didn't come up with any kind of imaginative names particularly, but north and west is what it is. So Hannah leads that, and then Danny is here to lead does the east primary care network. So useful contacts. There are other. Lucy does the HMG one, so that's the Hereford Medical Group. We're part of this, and we've also got one of the manager whose name I've just forgotten. It is Sue. Sue in the south and west. Thank you. I'm just shoot me there later, Sue. So really, part of the thing for us was actually how do we bring some of this together. And I'm conscious that you don't want to hear just about structures, but the key thing for us is that you can get variety of delivery at each practice. And one of the things we're trying to do is how do we actually support each practice to deliver the best care without repeating the same process, the same policy, the same development 19 times. How do we do that in a more collective way? So that's the kind of work that we are looking at and doing. How do we spread good practice, and how do we support each other? And importantly, how do we provide some resilience? Because clearly, there is a workforce challenge, and it is something that we can do much better collectively sometimes than we can do individually. I won't talk about the kind of the informal stuff, because I think that's almost irrelevant really for the meeting today. But these are kind of like what are some of the things we're trying to achieve, which I've mentioned already, I think, around that approach to kind of general practice working across the system in particular. And part of that, of course, is how we work with other partners. So I see Christine every week. Help at the kind of One Herefordshire partnership, as it mentions on there, working with Wye Valley and Mental Health Trust. And others there, the local authority, public health, and we come together each week. And that's supported by a clinical practitioner forum, which actually is there to design to look at pathway change and look at what we might need to do differently. And one offer is actually that CPF forum is one that I chair, and I'm really keen to consider if actually communities have ideas about how we can do things differently. It's a good one through Christine, I would suggest, to come to that forum, and let's test out the clinicians. Let's test out the kind of some of the to look at doing things differently. So really keen to look at that and focus on that. And the other areas there are just some of the things, but general practice communicates as part of that and works in a collective way. So these are the challenges. I probably don't need to tell you too much about obviously the recruitment stuff that we know about. But obviously there is an increasingly complex population in terms of the needs are changing, healthcare is changing. And of course we do have that kind of that traditional thing which about I want to see my GP, when actually it's about the GP team, the general practice team is important. And actually I would go beyond that, it's about the kind of team that's happening across other parts of the system, so that may be district nurses, it may be the voluntary sector as well within the communities. And certainly Will and I, we set up this first social prescribing stuff, didn't we, I think in Herefordshire. and tested that out. And actually, it's something which I think has built strength to strength, and I'll talk a little bit more around that in a second. But we do need to get better at prevention. So we do need to get better at that. Health is far too often we're firefighting. So one of the things we need to look at is how can we actually do things better upstream. And to be honest, we can't do that without you. That is the kind of dilemma that we're in. We need to actually think, how do we use each other in the best way possible? So these are some of the things we're doing. So we're trying to do some of the things at scale when it makes sense to do so. So that might be running a service across the county. We do these work hubs on the evenings and weekends. We're doing kind of a remote service where we've actually got to the point where we're turning GPs away because it's very popular to become part of this remote service. Now this is bringing GPs and other workforce into the county, and they provide support for every practice in the county on a daily basis. So it's really trying to make sure that people, if it can be dealt with on the phone, let's get it done quickly. If it needs face-to-face, let's facilitate that. And this is the idea behind some of this remote stuff, is to try and support that. We're looking at new roles. So we've got, I mentioned social prescribers. Don't particularly like the name prescribing, it sounds a bit medical. But the idea about it is the non-medical bit, which is actually how do you link in with communities. In particular, how do you look at providing that support when actually it isn't always a health orientated problem that the patient may present with. It's actually some things we can do in a different way. Social prescribing has gone from strength to strength, and actually is now increasingly working with wellbeing coaches, working with mindling workers, and we work with Luke here from the local authority, with Talk Community, and we're doing much more around that kind of that prevention of that team approach across those primary care networks. And what we need to see in that is more, I think, voluntary workforce as part of the team increasingly. We're obviously looking more and more about data, so we're getting better at producing and demonstrating what we do. And I mentioned, we talked about communication of all the things that we do. It's really difficult to explain what these new roles are about in particular. It isn't a way of saying, oh, can we just get someone to see someone instead of a GP because it's cheaper. It's more appropriate. So there's a link on there to explain some of the roles. So I'll give you an example of that is we have a first contact practitioner, a physio basically, a specialist physio, who will quite often, if patients ring up with a shoulder problem, you actually don't want to see a GP, being honest. You actually want to see one of these physios because actually that's their specialist area, and that's often misunderstood by the public, and it's a message that we're trying to get through. So again, your help with communicating some of that would really help us use the services in the best ways that we can to ensure that actually we free up our clinicians to do other things, to do the right, to make sure people see in the right place at the right time. I'll move on to kind of question just around the 24/7 stuff, because I think the fact that we run out of hours and we run a number of services across the county, we are looking at linking in patient care across 24 hours, 7 days a week. And I know that's an obvious thing to say, but actually it doesn't happen elsewhere. There are different providers all doing different things. And one of the things that we'd like to do, working with Wye Valley and local authority and things, is actually how do we bring services more locally? Wouldn't it be nice to localise aspects of 111? That's obviously that's a biggie to try and change that, but actually that's the kind of thing that we're talking about, is how do we link that together so that we have patients on the same record, so that you don't have to just talk about your problem more than once. And I know that's often highlighted, but already we have our clinicians in different providers, so district nurses, the hospice, general practice, we all use the same system. I can see exactly what the hospice have done in real time. And that makes a huge difference to our teams working as one. And I think one of the questions then for me is, to what extent do we want to involve that kind of with the voluntary sector and other parts of the communities? Where, is that helpful? Do we need to extend that? And there are things already with a system called Joy, which actually is supporting some of that work. We're also looking at kind of how do we improve the digital stuff, so improve people's access to healthcare, which actually can be 24/7, but actually it can be through online consultations, it can be video, it can be other things. And I think, again, this is all about trying to make sure, it's not about keeping people away, it's about making sure that people can actually, I hope, those that actually do need that can access it that way. It frees up time for those who can become face-to-face setup. So this is something about our Access Recovery Programme, which is going on at the moment, which we're trying to, ultimately, it's that bit in the middle. Which, again, very obvious statement, but actually, those are some of the things that we're doing to try and work together. So I think one of the key things for us is about integrated neighbourhood teams. So this is where we are trying to bring both management and the workforce to work as one team. So they learn together, they work together, and co-locate where they can. But actually they work as one team, regardless of who's your boss. So the end point of some of this integrated neighbourhood teams is not to say I work for this practice or my valley, I work for this area, this population. And I guess that's the bit that we need to aim for. And again, that for me is really then a sense of bringing communities together, working with general practice and working with other parts of the system. We work for that local area, and actually we're one team. So I mentioned a little bit about the remote hub, and again, I think I'm happy to take questions on it, but I wasn't going to linger on that one. But I do want to talk about talk wellbeing, because you've heard talk community, and this is, I hope, the health kind of side of the talk wellbeing, and this is something where we are trying to address going around different parts of the county to try and look at people's needs from more of a health point of view, trying to pick up blood pressure, cardiovascular problems, but actually a lot of it is really about trying to connect people from their, whatever issue they may have. That may be how do they register, it may be how do they access healthcare, there may be other questions we're linked to kind of more to do with what I was saying before about social prescribing, more to do with their finances, more to do with their problems at home, whatever that may be. But actually, this is the kind of, start of something which I think is going to grow bigger. So if I can introduce Sharon at the back, who works in that team, and the team is going around different parts of the county. So one offer is, to mention to you all, is if you think there's an area where there's a need in your local community, then actually let me, Christine, or Sharon know, they'd be really keen to actually build this up and actually address those needs in the community, working alongside Talk Community, and actually build some of this up so that we can actually really kind of improve the healthcare of those which probably struggle to reach some of the services that we recognise. So the homeless population in particular, we're going out to try and address those needs. I'm also conscious that there's a lot of stuff going on in practices, and there's a lot of stuff going on in primary care networks, which is all about how we link some of these things together and try and support that. So I'm hoping that Talk Wellbeing programme becomes much more all-encompassing for all the various things that we're talking about, which are leaning towards health. So the impact that we're making, I think it's important to highlight that we are those little, self-awarded stars. We are in the top 10% of that appointment activity across the UK. It may not feel like it every day, but we are there. And we were kind of top 3 in the UK for delivery of COVID vaccination, in terms of being on it and delivering it. We were actually, that's the latest lot. It was previously, we were leading the way early on in the whole pandemic for delivery. And I have to say, one of the things we relied on heavily were volunteers. And actually the volunteers during the COVID vaccination programme was fantastic, it was brilliant. And I don't want another pandemic, don't get me wrong, but to regain that sense of team we all had at the time, there's a special sauce in there really about how we all work together and actually create that sense of energy, that sense of I want to help my community out. So that's just something for us to, I suppose, to think about how do we actually take some of these things forward. And of course, we do have a kind of lowest A&E attendances that should be seen in primary care, which again I think is important to note, because actually A&E can sometimes be the overflow if we're not careful. And what we need to do is to make sure we're getting people seen in the community because actually they'll see the right person. It's not the right people, sometimes place to be in ED, or sorry, the A&E. So we're trying to bring together how we learn more collectively. We're trying to make sure that practices work together to, when things don't go right, that we learn from those in a much more collective fashion. Times of old, you could moan about it, but actually now it's around how do we learn from that, how do we work with other parts of the system to try and build on what we're doing already. And I think that's really gathering pace with how we do that across formal services, perhaps less so with how we work with communities. And of course, we need to obviously make sure that we future-proof general practice. So I just want to make sure that we're clear then on the opportunities then for us to work together is actually how do we move more upstream. So I think it's a real challenge for us to think around doing more things in the community. I'm very conscious of the voluntary sector, often being considered as doing things for free, and I'm very conscious that that's one of the kind of approaches that we need to consider. Is actually how do we invest in the communities, and actually how we link you in with your local practice, with your local primary care network, and indeed across Herefordshire. It's really important at all levels that we do that in a more effective manner and use people appropriately for what you do already. And I think that then will gather pace, and much like Will was saying earlier, that communication of some of the things that we do in a collective fashion is really important, that we understand what you're doing as well as you understand what we're doing, and then that way we can link together more. And I guess, I think the kind of integrated neighbourhood teams, I want to make sure that you're part and parcel of that. So I think that's important, that actually you feel part of your local network. So I would suggest that if you depending on which part of the county you're in, that actually you link in with those primary care network managers, you link in with the Talk Wellbeing Service, because actually those are really kind of things which are here and now, which I think could actually promote whatever you do already, which I think is part of the challenge that we all have. That's the board. We won't run about too much. Right, happy to take any questions.